The month of September is a time to spread awareness about something that impacts people of all ages, suicide. But a shortage in mental health workers is impacting when people can get help.
That's right. News Channel 20's Carolina Hassett tells us about the warning signs of suicides and resources that can help.
That's right. Well, it's taking longer for those struggling with suicidal thoughts to get the long-term care they need. There are some resources you can turn to in an emergency. Dr. William Mordock is a clinical psychologist. He says parents need to watch out for changes in behavior, an unusual shift in mood, and isolation. Mordock says relying on your child's school system can help. However, he says the demand for mental health resources is more urgent.
It's a little more urgent now than it has been, say, 10 years ago because of the impact that social media has had. A lot of bullying takes place. A lot of harassment takes place in social media sites, so that can be going on and parents not even be aware.
Now, Mordock added there are other resources helpful for those of all ages, including your primary care physician and many of the suicide hotlines that provide emergency care. Now, Mordock added here in Sangamon County especially, he has seen a struggle in finding mental health care workers since before the pandemic. In studio, I'm Carolina Hassett. Back to you, John.
Thanks, Carolina. Tune in tomorrow on News Channel 20, where we will dive deeper into solutions for combating the mental health care worker shortage and if doctors are worried that this will affect suicide trends.
Now to a health watch. September is the month to draw attention to an issue that impacts those of all ages, suicide. However, many are struggling to find that long-term care that they need after many shortages are impacting the healthcare industry. News Channel 20's Carolina Hassett spoke to several doctors on why they're still struggling with a shortage and if they are worried that it's going to impact suicide trends.
The whole mental health system suffers and the whole healthcare suffers when you don't have access to psychiatrists.
Many doctors have been feeling the impact of not having enough mental health professionals, which has been declining since before the pandemic.
Other professionals are left trying to manage psychiatric conditions, and they just don't have the training or expertise.
Many say this is due to more psychiatrists retiring each year and less entering the profession, along with the number of those being diagnosed with mental health disorders increasing.
My colleagues tell me that they typically have waiting lists of 6 months and longer. Crises in mental health, they don't wait 6 months.
And finding help is even worse in rural areas.
Springfield can be kind of considered a rural mental health area. That could be a partial issue of why we're not attracting enough mental health professionals.
And while hotlines are helpful for emergency care, it's the ability to provide enough long-term care that is missing. One of the primary solutions at the moment is leaving doctors to turn towards others in the industry.
We are actively working to train primary care doctors to better understand and be able to diagnose and treat mental illness.
In the meantime, doctors are concerned about how this will impact suicide and mental health trends.
Of course I worry about that. With lack of mental health supports, you're going to have people slipping through cracks. Invariably, the rates of depression and suicide are going to increase.
Now, according to the most recent CDC data, in 2022, Illinois had an average of 11 per 100,000 dying by suicide compared to the national average of 14. Thanks for watching. Stick around by subscribing today and don't miss a single video.